stupid idea, but yeah.
Hi there guys, welcome to Trust Me, I'm Almost a Doctor. So this week we're going to speak to one of our friends who's an F2 in Wales. I'm Abhishek.
I'm Caitlin.
And this is our friend Juinn.
Hello. My name is Juinn Lim. I'm a F Foundation Year 2 doctor, currently in breast surgery in University Hospital Landoc. I graduated from Cardiff and been working in Wales since. I was in Wrexham last year, and this year I'm in Cardiff.
We just have a couple of questions which everyone I'm pretty sure has as well. And we're going to ask Juinn this today and just kind of have a discussion with him. So Juinn, more importantly, what was the hardest part about transitioning from year 5 to F1?
The hardest part from med school to foundation years is basically you basically start work really. So the responsibility is the biggest difference between a medical student and a doctor. You have more work to do, you have more commitments, and a lot more people put more trust in you. So you have to meet the trust and put in the effort for it really. So that's the biggest difference between medical student and a foundation doctor.
How do you choose your rotations in F1 and F2? What are your priorities?
For me, my priority, so there's different, people look at different things. There is the location, there is the job that they want, and of course who will be there with you. If you have a partner, a wife, or a girlfriend, you have to apply together. So that's the one thing you have to think about. Then the other two things is the job. So for me, I want to do surgery, which is what I've chosen. So I choose a more surgical specialties that I'm interested in. And the last one is location. So it depends on where in UK you're applying for. If you're applying in Wales, you can choose between you can choose between 2 years. You can apply for different places in the 2 years really. But if you're in England, then you have to apply both years in the same place. So that's the only difference. And that's why I prefer to stay in Wales. You get to choose different places for the 2 years really.
Was there an added advantage to going to Wrexham compared to going anywhere else in Wales?
There is actually. So in F1 you should do 3 rotations. As I mentioned before, a medicine rotation and then a surgical rotation. And then the last one in Wrexham, they call it a third strand. Okay. So what you can do is you can pick a specialty among kind of a list, and it includes like ENT, ITU, and renal medicine. It's kind of specialties you don't really see commonly in F1. And if you're interested in a specialty, then you can do it.
What would you say are like the pros and cons of choosing a placement in like a big hospital in South Wales, like Heath, for example?
So there is a very big contrast. Obviously, one is a tertiary and one is a DGH hospital. And the biggest difference is in Wrexham, you know everyone, and you meet everyone every day, you talk about things, you discuss things, you have barbecues and meetups. But here, I haven't met all the foundation doctors yet, which is, it could be partly because of COVID, and we can't really meet up for teaching or sessions and all. But even without COVID, I think it'll be difficult as well.
How many F1s are there in Heath at the moment?
Ooh, good question. I would say probably 40, 50 maybe.
So quite a lot.
Yeah, that's quite a few, yeah.
And how many were there with you in Wrexham?
There were 20.
And what made you choose Wales?
I did my undergrad studies here in Cardiff, and when you're in Cardiff, you go to different hospitals across Wales for placement, as you guys know. So you kind of meet people, you know the hospital, you know the system, and you don't really want to move elsewhere and just learn it all over again from scratch. So that's why I chose Wales.
Have you been happy with your choice in Wales?
I actually have been, yeah. Met really good people, consultants, registrars, good doctors, and they give good advices as well. I don't really regret choosing Wales.
Did like SSA help a lot?
SSA, that definitely helped, yes. You work with the team for your first rotation, and because of that, you know how things work. So you're not thrown into your first job not knowing anything, and you know the people, you know what to do, you know how the consultant likes things to be done, so you don't screw up basically.
Do you have any priorities in deciding whether to do like medicine first or surgery first? Is there any way to choose, or?
For me, I chose medicine first and then go into surgery after, is because I know that it will be difficult for the first few months, and it was very difficult. I finished work basically late for the first few months, and it was very stressful period. And if I did surgery first, I don't think I would have time to do anything else, like projects, audits, theatre time.
Would it be important for me to learn how to drive by the time I start my F1 rotation next year?
So the good thing about working in Wales as a F1 doctor is that you get free accommodation for the first year, and most of the time it's actually pretty good accommodation, depending on which hospital you apply to, of course. And the accommodation is always next to the hospital, and you can walk to work.
What would you say in general are the challenges in the foundation program as a whole?
As a whole?
Yeah.
I think the biggest challenge is actually basically being a doctor. Exactly, yeah. You go into the wards and the nurses will go like, doctor this, got doctor that, and it's every question, there's always a decision, and the decision is important because it plays such a big role in patient's management plans, really. So you say yes or no, and things change. And you don't want to be the one that makes the wrong decisions, and make the wrong calls, and make which has like severe consequences, really. I've been there before. It's not very nice, but it's something you have to go through. So I think preparing yourself for that is really important. And other challenges would be working with other people. You're not gonna always be working with great colleagues. There's always gonna be some people that you don't get along with, really. And no matter where you are, not just in Wales. I think learning how to kind of handle those situations are very important. Patience and good communication skills, definitely something that you really need during your foundation years. Most of the time you're the middleman. So there's the patient, there's the staff in the wards, the nurses, the healthcare assistants, physios, OT pharmacists, and then there's the registrars, the SHOs, there's consultant, and there is many other people. And basically you're the people that they speak to, and then you are the one who tells people what to do. So if you get something wrong, then you kind of mess up the whole thing, really.
And how do you manage your work-life balance?
I have to admit, I'm terrible at it. It's difficult, and you have to constantly remind yourself that your work is not everything. And so you have to find things to do outside of work, go out for meals with friends, have exercise, hobbies, pick any hobbies, anything that's weird. Like I've picked up weird hobbies for the last almost 2 years. I started knitting, I've been making like metal models, weird stuff, really. And it does help you, it helps take your mind out of work, which is very important. And very important to stay in contact with your friends, even if you just meet up and talk about your daily kind of life. It's important not to keep it inside. It's always important to talk about it, really.
And if there's anything you would have done differently in like your 5th year before going into F1, what would you have done?
Ooh.
Besides get though.
So there's so many things, really. I honestly miss like uni life a lot. There's less responsibilities. You don't have that much commitments. You're free basically. You're free to do anything you want, and that feeling is what I miss most about fifth year. So what I would recommend is just do whatever you want. Don't hesitate. Go for it. Even if it's a stupid idea that people keep telling you not to do it, try. Why not?
Like this video.
Don't forget. Me and a few foundation doctors in Wales are organizing a teaching webinar session, and our first session will be on the 23rd of March. It will be talking about the Wales Foundation program, and what we've done is we've gathered foundation doctors from different hospitals across Wales to come and talk about what their experiences are and pros and cons in working in those hospitals. So you guys have a better idea on where to apply and how to rank the jobs basically. So do come and attend. It's on an online event and it's on Facebook. Just Google, just search for F1 Survival Guide in Wales, and you'll pop up. So do share with your friends who are coming to Wales as well, and we hope to see you there then.
Like, subscribe, and share.